Breaking Mzansi Insider reports. A tense moment unfolded in South Africa's parliament as Julius Sello Malema, leader of the Economic Freedom Fighters, EFF, questioned President Cyril Ramaphosa about the country's healthcare system and the progress of the National Health Insurance, South Africa, NHI. Malema raised serious concerns over the state of public health facilities, pointing out chronic shortages of healthcare workers, overcrowding, and poor resources. He asked the president two key questions: what progress has been made towards full NHI implementation, and what practical steps have been taken to ensure that hospitals and clinics will be fully functional when the NHI is rolled out. In response, President Ramaphosa defended the government's work, saying the NHI remains a priority and that preparations are ongoing. He mentioned efforts to strengthen public health facilities, improve management systems, and increase the number of healthcare professionals. He also emphasized that the NHI would be implemented in phases to ensure a smooth transition. Following the initial questioning by Julius Sello Malema, President Cyril Ramaphosa provided more detail on the government's efforts to prepare the health system for the National Health Insurance, South Africa, NHI. Ramaphosa explained that the government is focusing on several key areas: infrastructure upgrades, renovating hospitals and clinics to handle more patients and provide better care; staffing improvements, recruiting and training more doctors, nurses, and other healthcare professionals to address critical shortages; administrative reforms, strengthening hospital management and introducing systems to improve efficiency and accountability; phased implementation, rolling out the NHI gradually to ensure that each stage functions properly before expanding coverage further. He stressed that these measures are intended to ensure that when the NHI is fully implemented, the system will be able to deliver quality healthcare to all South Africans. Malema responded by emphasizing that while these plans sound promising, the government must act quickly and transparently to address the immediate crises facing public health facilities. Many opposition parties echoed his concerns, insisting that fixing the current system is crucial before introducing nationwide reforms. The parliamentary exchange between Julius Sello Malema and President Cyril Ramaphosa has sparked widespread discussion across South Africa about the future of the National Health Insurance, South Africa, NHI, and the state of public health care. Citizens, healthcare workers, and political analysts have reacted strongly. Public concern: many South Africans worry that hospitals and clinics are currently overstretched, and they question whether the NHI can succeed without first addressing these systemic issues. Support for NHI: some observers believe that the NHI is a necessary step toward universal health care, emphasizing that long-term planning and phased implementation could improve access and quality of care. Political pressure: opposition parties are urging the government to provide clearer timelines and transparent progress reports to ensure accountability in rolling out the NHI. The debate highlights the challenge of balancing immediate healthcare needs with the ambitious goal of universal coverage. Analysts note that the success of the NHI will depend not only on funding and policy but also on practical improvements to staffing, infrastructure, and hospital management. As the discussion continues, the nation remains focused on whether the government can effectively prepare the health system for this major reform while addressing urgent problems in public